Hey, welcome back to Brian and the Judge. Brian Kilmeade, Judge Andrew Napolitano, 866-408-7669. Governor Tim Pawlenty, Republican from the state of Minnesota, has been dropping some hints lately about any plans he might have in 2012. Governor Pawlenty, it's a pleasure. Thank you for joining us on Brian and the Judge.
Judge, I'm glad to be with you. I hope Brian's there as well.
Yeah, I am. And Governor, let me ask you first off to put your political hat on and talk about what the White House is doing with the Democratic Party. I mean, deciding who is going to run for senator in Pennsylvania, deciding who should not run as governor in New York. You're a governor yourself, and you used to call in your own shots. Would you be a little insulted if you got a call from somebody, even in your own party, to tell you what you're doing?
Well, I've had that experience myself, actually, Brian, when we had Senate and governor's races in Minnesota, and even in the Republican administrations, they try to influence the races sometimes in competitive states. So, in fairness, I think we got to acknowledge both parties have done it. Maybe not to this degree, but both parties have certainly done it in the past.
Publicly, and it's kind of humiliating, isn't it?
Yeah, it's usually done privately. They call in candidates to the White House and recruit them and court them and make phone calls. But, to do it this publicly is probably the unusual part of it.
Governor, are you planning to run for president in 2012?
Judge, I haven't ruled anything in or out. I'm going to finish my term as governor. As time allows, I'm going to speak out on ways that I think the Republican Party and the conservatives can improve, both here in Minnesota and nationally. But where that leads, I don't know. And I think we should be focused on 2009. We got two great governor's races going, and we can win them both, in Virginia and New Jersey. And then, of course, in 2010, we've got 37 governor's races on the ballot and many other important races. So I don't think anybody on our team should be looking ahead to 2012. I think that would be a disservice to the effort in 2009 and 2010. So first things first.
All right, on some level, since you are, regardless of your personal ambition, you are for your party, do you almost dare Democrats to go ahead and use reconciliation to pass their health care plan without you? Do you think, like many Republicans, that this would spell disaster for them?
I think, Brian, the process that you're referring to, which is to circumvent, filibuster and use reconciliation, would be horrifying to many of us, but to the American public, they may forget about it over 3 or 5 years. And if they use it and succeed in passing that bill, we'd be stuck, I think, with one of the worst pieces of legislation possible. And so while I know that would trigger a reaction and would trigger anger, and that might mobilize forces and help us in the elections, I don't think the price of admission, which is the passage of a really, really bad bill, a historically bad bill, is worth it. So I think we should try to defeat the bill. And one way to do that is to try to keep it out of reconciliation and use the other process available, including filibuster if need be.
Historically, Governor, and I know you know this, the danger of legislation which creates a sort of a social giveaway is that once it's enacted and people rely on it, plan on it, and expect to receive that giveaway, it's virtually impossible to end it. I don't think the Supreme Court could declare Medicare unconstitutional even if it wanted to, because generations of seniors have relied on it. If people start relying on Obamacare, if it becomes law on day 1, we're stuck with it on day 2, on day 2002, on day 20,002.
History would suggest, and the track record would suggest, you're exactly right, Judge. And every major entitlement program that they run and manage currently is on a pathway towards bankruptcy. Social Security is on a pathway towards bankruptcy. Medicare is on a pathway towards bankruptcy. Medicaid is on a pathway towards bankruptcy. They can't even manage and properly run the ones they have. Why would we give them another one? The idea that they're going to take over this much of the economy, this much of the healthcare system is frightening. But I think you're exactly right. If they succeed in getting it in, and they continue to give away the illusion of free stuff, and as you know, it's not free. It's very corrosive to what I believe and what you believe. It'll be very difficult to get it back, very difficult to peel it back or even amend it.
What is so difficult about going with your general's plan after you asked that general 5 months ago to come up with a plan and put him in place to do that plan? I'm talking about General McChrystal's report leaked from the Pentagon about what he wants to do and recommends going forward in Afghanistan. Where's the disconnect, and does it concern you?
It concerns me a great deal. I'm very concerned about what's going on the national security front, including the United States under this administration pulling the rug out from underneath two of our best allies in Europe, namely the Czech Republic and Poland. They had leaders there that stuck their neck way out.
With missile defense.
At our request with missile defense, and now they're getting the rug yanked out from underneath them. But as it relates to the McChrystal report, it clearly, at least according to the leaked sources, is going to involve a significant increase in troops. There's a great discord within the Democratic Party about that. And instead of taking the report and following the direction of taking the input of the leaders on the ground, it looks like the Obama administration is going to consider some of the political considerations within their own party. And so that's concerning. That's unsettling. And even the suggestion that the report be delayed was concerning. I think we want to have people on the ground be able to frankly and timely submit their recommendations, and any delay of that is concerning as well.
Well, what should the Republicans do when the White House says, well, look, at least we're trying to solve this health care problem. Propose your own plan. My view is this is not an issue for the federal government. They should deregulate insurance companies so that I, as a resident of New Jersey, could buy coverage from a carrier in Minnesota, which, as you now know, I can't. How can you make the free market argument in a way that it's appealing to people?
Well, it really boils down to this, Judge. There's so many things that we could do on a bipartisan basis, including getting rid of jackpot justice and medical malpractice reform, allowing people to get insurance across state lines so we could open up the market and get more competition, allowing risk pools to form across state lines through associations, using more technology through electronic medical records, electronic prescriptions. But the big kahuna here is we got to have a system where consumers and families are in charge, and there's financial incentives and, if need be, help. But it's in a marketplace. So, for example, we got right now, if you and I go to the doctor, the hospital, the clinic, or provider, after you pay your out-of-pocket, after you pay your deductible, what do you care what it costs? You don't, and in fact, I don't. If I feel like I'm getting more health care, I feel like I'm getting better taken care of. And on the flip side of it, you have providers who get paid for volumes of procedures, and if they get paid for volumes of procedures, they're going to be inclined to perform more procedures. We have to have payments that are geared towards better health care outcomes, not just towards more volume. And we also have to make sure that people are in charge of the decisions, not the federal government. So that's
right.
A mouthful, but that's the direction we should be heading as Republicans. This is about affordability as much as it is about access, and we need to empower people to make those decisions. If need be, fund them, help them if they're disadvantaged, not the federal government.
Governor, good luck. I hope you announce that you're running for president. When you do, it'll be here. It would mean a lot to the judge.
All right.
All right, Governor Tim Pawlenty, great talking to you. Look forward to seeing you out in front for your party. Thanks so much.
Thank you, Governor. 866-408-7669. You heard all the issues from Afghanistan to health care. Your turn to call in on Brian and the Judge.